Friends, when you have a case like this, you might think dental implants. Right away, that's the first thing you think of. But what happens when there's no budget? When there isn't good bone, when there's no time, or when the patient simply doesn't want or can't get dental implants? In this case, what do? I'm going to show you what we did with this patient who kindly allowed us to share his case, because it's important that you don't lose hope if you don't have the money, the time, or the health for dental implants. Other treatments can be done that are sometimes temporary or sometimes can be permanent if you want. In this case, our patient was missing his anterior teeth, meaning the front teeth, and his aesthetics definitely didn't help him. In fact, he told us he'd had a hard time finding a job because, well, he can't speak well, he covers his mouth, he was, well, like this, right? Let's look at the next image. If you look at his display, as we call it, how he smiles, how it looks, well, you can even see the gums, right? This is a complicated case because if we want to put in dental implants, we have to make the teeth come out from the gums so that it looks natural. Now, if we want to do some other treatment like the one we did, we also have to be very careful with those issues so that the difference between his gums and the gums we're going to place isn't visible. In this case, his bite was very well suited because he has a really good bite on this side and on this side too. So we were able to, here in this space in the back, there's a little gap, we were able to put in some little hooks and make him a removable appliance. This removable appliance is made of acrylic with metal. It has hooks, and even though it's very traditional and has been done for many years, it's a great option. Sometimes this option is considered temporary while you get the money, the health, whatever you need to get to be able to do implants. And sometimes patients decide to stay like this. This patient is visiting from far away and tells me, "I don't have the time, doctor. I need something to help me, please, to have a nice smile now, to be able to speak well with my clients and start dealing with them. And later I'll come back for the implants because he needs a bone graft, as we saw in his CT scan." So what was it that we did for this patient? This is the result we achieved with him. Please look at how natural these teeth look. Even though they're teeth from a removable appliance, see how you can't tell the difference between his teeth and the removable prosthesis? What does this mean? That with the removable prosthesis, you can have a very pleasant life. You can smile, and people practically shouldn't notice that you have something fake if they're well made. Look, for example, at the front view. Here we definitely managed to hide this hook as much as possible in a medium-high smile. On this side, we couldn't avoid the hook because the prosthetic equator, that is, like the belly of the tooth, was very low. You can't put the hook very high because, well, there's no way for it to go in. But really, seeing this and seeing the full set of teeth is nothing compared to how it was before. In this close-up shot, we can see how natural the teeth look. These teeth are made of resin and they look absolutely spectacular. They have mamelons and very natural lines. So when the patient smiles, the teeth look completely real. Please take a look. That's his tooth and those are the removable ones. They look quite similar. And finally, we have a full face display here, where we see how the teeth align well with his midline. Of course, we had to take photographs, do calculations, and we do most of the planning on the computer. Why? So that everything is in harmony with what we are doing. We have to look at the interpupillary line, midline, and facial thirds so the teeth fit in. As you can see, he looks young and happy, and the change is truly impressive. Please take a look at how it was before. So we go from a patient who doesn't want to smile and can't pronounce F, R, or S because it's so hard, to a patient who looks super happy and very natural. Now, I ask you, if we had the option, what would we have done in this case if it weren't a removable? Well, obviously try to place a bone graft to lower the scum line a bit. Sometimes it's very difficult, very complicated, and we have to work with what we have. If this is what we have, then we have to place an implant on this side, another implant on this side, maybe a third implant because we're talking about 5 teeth here, ideally at least. Implants spread out and a fixed prosthesis screwed onto the implants. If it's too complicated to lower this gum line, and believe me it is, then we choose to do a PF3. The PF3 is a fixed prosthesis, but it includes the gum. That means the tooth comes down, and then after the tooth, there's a little bit of gum. The gum is a natural pink color, and we try to replicate that color. And what we achieve is matching the gum color with porcelain to the patient's gum color. In this case, it might be ideal if the gum line couldn't be lowered and it can be resolved, but as you saw, a removable was enough. What does it depend on? It's 100% up to you. If you want something you take out and put in every day, go ahead. If you want something fixed, implantology is an option, but always remember to get many diagnostic tests, starting with blood tests to check your cholesterol, triglycerides, and vitamin D. It's important to know the health of the entire body. Second, the bite. It's very important that the bite is good and aligns well. If the bite isn't good, it's better to correct it first. Third, the gums must be healthy, with no periodontal disease or gum disease. If everything is very, very good, we also have to look at aesthetics, how much the patient shows. Sometimes the patient shows so much that we first choose to operate on the lip to lower it, or use Botox. There are many things you can discuss with your dentist, but the most important thing is a good diagnosis and always knowing that you'll have the opportunity to look good without the absolute necessity of getting dental implants. Of course, removables also have their problems. These have to be attached with hooks on teeth. Those hooks can eventually cause problems for those teeth, so that's why I don't like to consider them for the long term. Second, the leverage created by removables can also help loosen the supporting teeth a little bit. Third, the removable is supported by both the tooth and the mucosa. They're called tooth and tissue supported, which could cause the mucosa to recede if we bite down too hard against the gum in the teeth. Can also get damaged. And of course, they can also end up being uncomfortable because they can shift around a little bit. So, like everything, there are pros and cons. Friends, talk it over with your dentist to see what's best for you. And as always, on this channel, we give you information so you can make the best decision. If you like this video, give it a like, of course. Share it with someone who's hesitant, trying to choose between implants and removables. Subscribe to the channel, and I'll see you in the next one. Take care, everyone.